da 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 da. Let's do some examples of errors because these are really easy things to get mixed up on. We have here our two universes, null and alternative, and each of the error types. Now, our first scenario is going to be we go into the doctor to be tested for some disease. Let's make it dramatic and say cancer. So we're going to be tested for cancer. What the doctor does as he draws your blood is he's looking for certain things that are indicators of cancer. So the null hypothesis is going to be that he detects 0 of them. And anything more than that will be an indication that you do have cancer. Now we could put our less than or equals to. Of course you can't have less than 0 indicators in your blood. And I'm not really a doctor, so I'm kind of making that up. I don't really know how they mark the indicators. The point is, when you walk into that doctor's office, the null hypothesis is going to be no cancer. Same if we were doing a drug test to see if someone was using illegal drugs. You assume by default that they are not. Null hypothesis says equals 0, no difference, nothing exciting. Alternative though, that would be an indication that there is a sign of cancer. So over here we have 4 different scenarios. 2 of them are good, 2 of them are sad. What is a confident doctor? Confidence says when the null is true, the null hypothesis said there is no cancer. And they're going to fail to reject. They're not going to say, I think this is wrong. They're going to say, I don't see any indication of cancer, and the fact is you don't have cancer. So a confident doctor knows when you're just fine. What's a powerful doctor? For power, we're assuming the alternative is the truth. The alternative says you have cancer. So if you have cancer and you walk into the doctor's office, can he reject the idea that you're healthy? Is he able to understand and recognize when you have cancer? A powerful doctor knows when you are sick. Type 1 error, the alpha. What is this story? This story is someone who does not have cancer, comes in, and the doctor believes they do have cancer. So a type 1 error is when a healthy patient is told they have cancer. And that's a bad thing. You've scared someone needlessly. Of course, you can't expect to never make mistakes. But a type 2 error is a completely different story. Here it was the alternative that was true. We're talking about a patient who has cancer. And what happens? The doctor does not reject the idea that they're healthy. And a patient with cancer being told they are healthy, that's not good. They need to know and possibly start treatment, depending on what kind of cancer we're talking about here. So both of these are bad. The question is, which one is worse? A healthy patient told they have cancer, they panic and freak, but at some point, someone's going to realize that's not true. Patient with cancer is told they're fine, they go several more years without treatment, the risk of dying is higher. Most doctors say this is the worst type of error. We want to lower our beta. How do we do that? The trade-off is between alpha and beta. So if I want to lower my beta, I'm going to raise my alpha. Here's a picture of what's happening. A patient walks in and it's assumed they are healthy. And the doctor starts gathering evidence and looking at it, and maybe if there's enough evidence, he'll declare there's cancer. What happens if a patient's here? There's a mass on the sonogram and maybe certain levels are elevated but not a whole lot. Well, if we want to lower type 2 error, then we raise our alpha. So that if there's even a little bit of evidence, we're going to tell the patient, look, I think you might have cancer. Let's continue testing. Let's investigate further. And so a lot of doctors will pull this alpha level in. Instead of an alpha level of 0.05, let's do an alpha level of 0.1, or maybe even 0.15. 0.2 is pretty extreme. I have actually seen an alpha of 0.25, but that was pretty extreme.